Hello everyone. Today we will be studying about the different methods of working length. Inside the tooth, it appears like a living hall which is divided into living room and a small balcony. The main door here represents the coronal opening. Between living room and balcony is an inner door which indicates minor constriction of tooth. And balcony is the end of the hall. Or you can see the end of the home, that is tooth, representing major constriction. Now the owner of this home is thinking to lay a nice carpet in the living room that is obturating the tooth, and for this, he requires measurement of the living hall. But he doesn't want to lay carpet in balcony beyond the gate. That is, obturation should not be done beyond minor constriction. Now we will be learning about the Ingles method to determine the working length. To lay the carpet, we need to first take the measurement of the living room. Before buying this flat, the builder of this flat named Ingle had already provided the measurement of the living room. Let's assume it to be 25 mm in the document, which indicates the X-ray of this flat even before starting the procedure. But this measurement is taken considering the 1 mm of balcony as well. So for carpet, we need to subtract 1 mm, which becomes 24 mm. From this we can remember that preoperative X-ray is taken to determine the radiographic working length. Now in reality inside tooth it is bloody, which is indicated by red filter for blood. After this, to check for the length of the room, a red-colored measuring tape is used, measuring till 24 mm as per the documents. And again an image is taken. Now here we can see that with radiographic filter, the tip is reaching till the end of the living room, which is the exact working length. But sometimes it may be inside the living room or go beyond the balcony. For this, we need to correct the working length of the room, that is tooth. Next, there may be some atmospheric changes according to which the carpet length is changed. In normal weather, it is 1 mm away from the wall of balcony. If it's raining peripherally, it is 1.5 mm away from the wall to protect the carpet, meaning there is peripheral bone resorption. And if it's flooding in room, it is placed 2 mm away from room, meaning there is both root and bone resorption.